Okay, so for my Aphibio disease project, I chose to do heartworms, parasite, in dogs. The scientific name for it is Diofilaria immitis. So the cause of this disease is from a eukaryotic parasitic heartworm. The cause of the heartworms begins when the infected mosquito takes a blood meal from the mammal. Most commonly seen in dogs is through a bite wound. Because through this bite wound, the mosquito's proboscis is infected with the heartworm, so then it is transmitted to the dog. And this introduces the third stage of Diothofilare immitis into the skin of the definitive host, this time being a dog. Next, inside the host, the parasite undergoes two molts into L4 in adults. The adults reside in the pulmonary arteries and the right ventricle of the heart, also in the lungs, causing a cough. In the heart, adult female worms can produce mycophyllaria, which are found in the peripheral blood. So they are produced in the heart, and then they are pumped throughout the body through veins in the bloodstream. And these aren't heartworms; they are little heartworms. They're basically the larvae form, and this happens in female heartworms over their lifespan of 5 to 10 years. A mosquito can then ingest the mycophyllaria through a blood meal from the host of the parasite because it is in their extremities, where they can then develop into stage 3 larvae in a mosquito's proboscis and then repeat the cycle. The history of this disease has always been kind of negative. The attitude has been negative. From this first sketch of this parasite was found in a horse heart in 1586 by Ches Wolf and described as a monster. The disease has been known for over 100 years, and the first case was documented in dogs in an issue of the Western Journal of Medicine and Surgery in 1847. Heartworms disease was first thought to only infect dogs in the southern U.S., but now it is known that the disease is much more widespread and can infect cats and other mammals. The epidemiology of this disease. So, Diofilaria immitis is most commonly found in regions of tropical or temperate climate near the equator, because this is the most good for mosquitoes to live in. It is most prevalent in the USA, South America, Japan, Australia, and Italy. In the U.S., after Hurricane Katrina, the awareness of the heartworm disease spread because more than 80% of the dogs in New Orleans shelters tested heartworm positive, and then they were adopted and spread throughout the U.S., so that disease was transmitted across the country. The mode of transmission for heartworms is through the bite of an infected mosquito because the T3, the immature parasite, before it undergoes two molts, lives on the proboscis of an infected mosquito and is then directly transmitted into the bloodstream of the host. The rate for dogs contracting this disease is for every 200 dogs, one tests heartworm positive. For the pathology of this disease, heartworms can affect the cardiac muscle tissues, and the mycophyllaria affects the epithelial skin tissues as well as the connective and smooth muscle tissues within the veins and arteries when the host is bitten to contract the disease. The organ affected with heartworms is going to be the heart and the veins and the blood, so the cardiac system. Eukaryotic cells are all used within the process of the disease, from the mosquito to the infected mammal. To identify if a mammal is infected, a blood test is given to test for the presence of heartworm proteins within the blood. For mycophyllaria to grow into heartworms, likewise for heartworms to increase in population, carbohydrates and protein must be consumed from the host's blood, weakening the chances of survival for the host. Dogs are usually treated with 3 injections of melarsomin, a drug. It is that can kill the heartworms, and then they're given a preventative drug like Trifexis, which my puppy Kona is on now because she used to have heartworms, and they take this periodically. I think it's either 6 months or every 3 months. Dioxycycline is an antibiotic drug that can be used to treat wool bacteria. These are a bacteria actually living on the parasite, and they are actually in a mutualistic relationship because the wool bacteria are helping the parasites, but this drug is made to kill the wool bacteria, so it can hurt the heartworms. And it can also treat the unwanted side effects by inhibiting protein synthesis and the selective permeability of the cells within the unwanted microorganism cytoplasmic membrane. Once the mammal is infected with microfilariae, the path to travel from the bloodstream to the right ventricle of the heart takes about 2 months, and then they mature into female adults after 6 months, thus beginning to reproduce over a period of about 7 years. So the signs and symptoms of this disease are classified into 4 classes, 1 through 4, 4 being the worst. And in class 1, the symptoms, there are no symptoms or it's just a mild cough because of the worms beginning to grow in the heart and sometimes in the lungs. Class 2 is marked by mild exercise intolerance and a persistent cough. Class 3 will result in greater exercise intolerance and normal lung sounds, weak pulse, syncope, fainting caused by impaired blood flow to the brain, decreased appetite, weight loss, and ascites, swollen belly due to heart failure. So this greater exercise intolerance is going to be because the parasites are taking blood from the host and they are decreasing the volume available in the heart to pump blood. So class 4 is known as Caval syndrome, a life-threatening cardiovascular collapse, which is marked by labored breathing, pale gums, a dark coffee-colored urine, which leads to organ failure and death, sadly. So those are my references, and then the questions that I had. One was, how could this heartworms be prevented for good? Like, how could we stop it? And then and then my second question was, which came first, the parasite? Was the parasite infected first, or was the dog infected first? It's kind of like the chicken and the egg scenario, which one came first? Yeah.